Hello, my name is Ivy. I'm a fourth-year social work student at Toronto Metropolitan University. I'm currently completing my placement with the Organization for a Safer Space. Today, I will be talking about dependent personality disorder. In this video, we'll first look at what dependent personality disorder is. We'll then look at the risk factors, symptoms, effects, treatment, and lastly, we'll look at some coping strategies. Dependent personality disorder is characterized by a continuing pattern of extreme psychological dependence on other people for validation, to be taken care of, and the fulfillment of one's emotional and physical needs. People with this disorder have difficulty being alone and are often described as clingy or needy. They have trouble making decisions and may believe that they are unable to take care of themselves. Therefore, they may deal with insecurity and low self-confidence. The signs of dependent personality disorder typically occurs in early to mid-adulthood. Risk factors. Dependent personality disorder is believed to be caused by the following risk factors. Genetics. Having a family member with dependent personality disorder increases one's chance of developing the disorder as well. Childhood experiences. Experiences such as an illness, neglect, or abuse during early childhood can increase the risk of developing this condition. Abusive relationships. A 2017 study discovered that people who are in unhealthy relationships involving abuse or infidelity may have a higher chance of developing dependent personality disorder. Lastly, cultural practices. Some cultural practices emphasize reliance on authority. Symptoms. Common symptoms of dependent personality disorder include difficulty being alone, a fear of rejection, a fear of abandonment, difficulty completing tasks alone, difficulty making decisions, a reliance on friends or family for decision-making, a continuous need for reassurance, oversensitivity to criticism or disapproval, a lack of self-confidence, behaving submissively in relationships. When a person with dependent personality disorder is alone, they may experience anxiety, nervousness, fear, panic attacks, and hopelessness. Effects. If left untreated, people with dependent personality disorder can have an increased risk of developing depression, anxiety disorders such as panic disorder, obsessive-compulsive personality disorder, or avoidant personality disorder. They may also develop phobias, remain in abusive relationships, and develop alcoholism or drug addiction. Treatment. The most common form of treatment for dependent personality disorder is psychotherapy. Types of psychotherapy can include cognitive behavioral therapy and psychodynamic therapy. Through psychotherapy, a mental health professional can help a person understand the reasons why they are dependent on other people. They can also help a person develop their confidence and build healthier relationships with their loved ones. A mental health professional can also help a person with dependent personality disorder understand their thoughts, feelings, and behaviors, and develop healthier ways of thinking, behaving, and reacting to situations. Depression and anxiety are also common in people with dependent personality disorder. Thus, they may be prescribed medication, such as antidepressants. Coping strategies. There are several methods a person can use to cope with dependent personality disorder, such as learning to trust oneself. A person can listen to, reflect, and act on their thoughts and feelings. They can learn to trust their instincts and believe in their capability to manage their circumstances. examining one's need for approval. Becoming more independent. A person with dependent personality disorder can analyze the ways they depend on other people. They can gradually start doing tasks without the support from others. This can include shopping for groceries alone. And become more physically active. Exercising and pushing oneself to gradually do more each day can motivate a person, as they can learn how strong and capable they are. If you have any of the symptoms described in this video, it is important to seek help. Feel free to check out the Organization for a Safer Space at forasaferspace.org, where you can have access to accessible, affordable, and affirming mental health care with licensed mental health professionals. Thank you for watching and have a great day.